Hi Jennifer, I'm Becky. I'm going to be your nurse today. The doctor has ordered that we put in an IV so that we can do IV antibiotics later on. Can you tell me your full name, please? Okay, Jennifer Doe, and I'm going to provide for privacy. Can you tell me your date of birth? She says 11/5/1975, and that matches her armband. Okay, Jennifer, can you keep your arms still for me while we do this procedure? And she says she can. I'm gonna have, do you have a preference of what arm we use? She doesn't, and she doesn't have any contraindications of why we shouldn't use her right arm. Okay, like I said before, we're gonna be inserting an IV, and we're gonna do this so that you can get some IV antibiotics later on if the doctor prescribes. So I am going to, so this is a tourniquet, and we're gonna put it around your arm to see if we can see the veins, help them pop a little bit more. Found a nice straight vein here that is away from joints and everything. Okay, we gotta release the tourniquet because that can't be on for more than 2 minutes. Okay, Jennifer, do you have any allergies? She says she doesn't, and that's what I have here on the MAR. Okay, now looking at all of my supplies, my saline flushes are not expired. The Tegaderm we're using isn't expired, and the tubing and the needle we're using is not expired. I'm going to put this pad underneath there to help keep things clean. And we want the tourniquet to be approximately 15 centimeters above where we are going to put in the IV. Okay, now I'm going to prime the tubing. I'm going to clean the end off here. Okay, so that's all good to go. Wash my hands again. And then if I was putting an IV in on a child, I would let them probably play with the tubing, might show them what we're doing on a doll. If I was doing this on an older patient that might be confused, I might have another nurse with me to help hold their arm still. Okay, close put the tourniquet on again. Feel for a pulse, make sure I'm not obstructing blood flow. Got a nice vein there. Now we'll clean the site. in a circular motion, starting from the inside going out for 15 to 20 seconds. And I might have her open and close her fists a few times to help that vein pop out a little bit better. And we'll let that dry completely. And then on my Tegaderm, I will write the date, the time, and my initials. So I have her hold her arm nice and still. I'll pull the skin taut, and I will go in at a 15-degree angle, bevel up, till I see a flash. And then I would lower the needle, advance it another 1/2 centimeter, and then I will push the catheter up, remove my needle, and put this on, release the tourniquet. Then we'll flush. Flush and clamp. And then we'll tape with the catheter. So we can put the Tegaderm on. And then this needs to be flushed at regular intervals to make sure that it's patent. And then I can add more tape if I want to put that up so that it doesn't keep flopping all over the place. Remove this. And then I would clean up my supplies, make sure she's comfortable, lower the bed, make sure she has her call light, and then I would document where the IV is placed, the time I put it in, the number of attempts it took to put in the IV, the solution used, the amount of solution I used, and how the patient responded. And that's it.